Hi everybody, a very good evening. Hope each one of you have given your best in this INICET May entrance exam, right? Okay, so we'll have a recall of the questions that appeared in anatomy, and then, we'll do a quick analysis also, right? So, as usual, 100% strike percentage in anatomy, yes. In ADrPLEXUS, we have covered all the questions either in conceptual form. Yeah, the workbook has also been very much useful in all those questions. So we'll start with the first one. Which of the following are supplied by superior gluteal nerve? This is one like star question, right? Every year it keeps appearing in some form or the other. And we did revise it in a rapid revision, of course, yeah. And also it's a straightforward direct question, isn't it? So what is the answer? The muscles, the three muscles which are supplied by superior gluteal nerve are gluteus medius, minimus, and tensor fascia lata. Right? So the options were A, B, and D, isn't it? So hope all of you got it right. Yes, we did cover it in a rapid revision class, isn't it? Yeah. So this gluteal region, pterion, cerebellum are questions which are they keep asking repeatedly in every year exam, but in some form or the other. Okay. So we'll just quickly revise few points related to this topic. Can you identify this muscle in the gluteal region? That is gluteus maximus. What is this? This is the gluteal upper neurosis. And what lies underneath it? Where you give the intramuscular injection, gluteus medius. Okay, so here you can see the maximus is cut. Okay, and this is the gluteus medius. Once the gluteus medius is removed, what is underneath it? Gluteus minimus. In the same plane as minimus, you'll get to see the piriformis. So what is the nerve supply to all these muscles? Yes. So the piriformis is the key muscle in the gluteal region. And it's very easy to identify this muscle because just below the lower border of this muscle, you can see the sciatic nerve emerging below. So you see the nerve, then the muscle just above it is going to be the piriformis. You see the piriformis and the nerve emerging below, that's going to be the sciatic nerve. So no confusion at all. And above the piriformis, what is the muscle that you get to see? Gluteus minimus. Okay. Yeah. So this will be the gluteus minimus. And this one below the upper neurosis is gluteus medius, into which the intramuscular injection in lower limb is given. This one cut and reflect, that's the gluteus maximus. So what is the nerve supply to these muscles? Yes, so the nerve that you see here, which emerges above the piriformis, can you see here, label it as 1? Yes, above the piriformis, the nerve that emerges is superior gluteal nerve, right? Superior gluteal nerve. And I'll take another color here, and you can see a nerve emerging below right here. Yes, this is the inferior gluteal nerve. Now looking into the image, can you identify? See, the branches of the inferior gluteal nerve, which muscle does it innervate? Gluteus maximus. And the branches of superior gluteal nerve, yes, as you see here, you can see it going to innervate medius, minimus, and one more, tensor fascia lata. Okay. So three muscles innervated by superior gluteal nerve, right? Okay. So here, as I told you, you can see the sciatic nerve, right? This is the sciatic nerve coming down. You can identify the piriformis here. Above that is, yes, the medius is still here. Below that will be the minimus. Yeah. So yes, the nerve supplied to gluteus maximus, as I told you, inferior gluteal nerve. Okay. Medius, minimus, and tensor fascia lata, all of them are going to be innervated by superior gluteal nerve. Actions of maximus is, it is a main extensor of the hip joint. It is also a lateral rotator, and the upper fibers cause abduction. We have revised it, right? These three muscles which are innervated by the superior gluteal nerve, medius, minimus, and tensor fascia lata, they are the medial rotators of the hip and abductors. Okay, remember the Trendelenburg gait. What happens in Trendelenburg gait? When your left foot is off the ground, the pelvis on that side is prevented from sinking by the contraction of the muscles of the opposite side, right? So the left pelvis is going to sink. Then what is the problem? The problem is with the right superior gluteal nerve, which innervates the gluteus medius, minimus, and tensor fascia lata. So you can never imagine appearing for your NEET-PG or next or your INICET exams without thorough in and out of this topic you should know. Okay, including the attachments of this muscle. We'll move on to the second question. Yes, anterior relations of third part of duodenum are all except. So this is again a sort of a direct question, right? Okay. So previously they've asked about the relations of the left kidney. Do you remember that was also anterior relations of the left kidney in 1 year? Okay. So what is this? You know, the duodenum has a first part, the second part, the third, and the fourth part, right? The third part, you can never forget it if you have seen it once. Anteriorly, what does it run? Yeah, you have the superior mesenteric vessel, superior mesenteric vein, and these are contents in the root of the mesentery, right? Okay. Apart from that, you can also get to see coils. Yeah, the jejunum coils of the small intestine. Which one cannot be related to the third part of the anti-relation for the third part of the duodenum? Yes, which one? The gallbladder. The gallbladder will be, of course, related to the first part. Yeah, so as you see here, so this is the third part. Can you make out the superior mesenteric artery, superior mesenteric vein? Okay, so here is the fundus and the body and the neck of the gallbladder, which are not related anteriorly to the third part of the duodenum. And one more syndrome, do you remember? Yes, so this is the abdominal aorta. The superior mesenteric artery is going to originate from the abdominal aorta opposite L1 vertebral level. Okay. Now, what is going to lie sandwiched between the abdominal aorta and the origin of superior mesenteric artery? Yes, three structures, three important structures. Do you remember? Yeah, I'm showing it blue and a lumen. What could that be? And then something, a glandular structure. And one more, yeah, I'll make it purple, but that's our third part of duodenum, right? This is again with the lumen. Okay, so there are three structures that are going to be sandwiched between the superior mesenteric artery origin and the abdominal aorta. What are those three structures? The one immediately below, this is the left renal vein. And below that, the uncinate process of pancreas. And below that comes the third part of duodenum. Yes. Now, this aortico-mesenteric angle, if it gets reduced, okay, then it can compress all these structures, isn't it? Leading to varicocele on the left, obstruction of the duodenum, right? So this goes by the name. Any idea what is this syndrome called? Yes, Wilkie syndrome. Okay, since it's related to third part of duodenum, I've just mentioned it here. Okay, the Wilkie syndrome. Yeah. And the third question, and it was like a bloopers. The comments were given in the image itself. The answer was also mentioned, right? Okay. So, which of the following vessel is involved in the image shown? So that was a cross section of medulla, and the posterolateral part of it was shaded. And what is it? That's of course, it's the lateral medullary syndrome, which is also called Wallenberg syndrome. Yes, it occurs due to occlusion of which artery? Yeah, the posterior inferior cerebellar artery. It is also called the pica syndrome, right? So yeah, undoubtedly you would have marked it right, I suppose. A few words about the syndrome. So what are the structures which undergo ischemia in the posterolateral zone of medulla? Yes, nucleus ambiguous. Yeah. Then you can get to see the vestibular nuclei. Yes. The inferior cerebellar peduncle is there. What else is there? The spinal tract and nucleus of the trigeminal nerve and spinothalamic tract, the lateral spinothalamic tract. These are the very important ones that lie there. So nucleus ambiguous, what is it going to give rise to? Yes, 9, 10, 11, the special visual efferent fibers, right? Yeah, 9, 10, 11, which is going to supply the muscles of soft palate, pharynx, and larynx. So what will happen in this syndrome? Ipsilateral paralysis of the muscles of soft palate, pharynx, and larynx. Okay, vestibular nuclei will lead to giddiness, right? And cerebellar peduncle, involvement ataxia, spinal tract of the trigeminal nerve, which is going to carry the sensation of pain and temperature from ipsilateral phase, right? And spinothalamic tract, pain and temperature from the contralateral body. So these are the features of Wallenberg syndrome or the lateral medullary syndrome, which is caused due to occlusion of posterior inferior cerebellar artery. That was an again easy question. What is the action of the pointed structure? Yes. So the muscles of the back, they're arranged as the superficial and deep muscles. In the superficial layer, you get to see the trapezius, isn't it? And lower down, latissimus dorsi. Once you remove the trapezius, you can see the muscles attaching the scapula to the trunk and the vertebra. So what are they? So as you see here, this one here is the levator scapulae. The one shaded here, connecting the vertebra and the medial border of the scapula, those are the rhomboids, major and minor. Above the spine of the scapula is the supraspinatus. Below the spine of the scapula is the infraspinatus. Right? So what are the actions of trapezius? The upper fibers of trapezius is going to elevate your scapula. Right? Upper fibers is going to elevate your scapula. These fibers. The lower fibers will depress the scapula. And the middle fibers, yes, they will pull the trapezius towards the vertebral column. What is that action called? Pulling it towards the midline of the vertebral column. It is called retraction. Which fibers of trapezius? Middle fibers of trapezius. Okay. And the upper and the lower fibers, they rotate the glenoid cavity upwards. As you do your overhead elevation of arm, you want to lift your hand like painting the ceiling or something. Overhead elevation of arm is by the combined action of upper and lower fibers of trapezius. Okay. Now coming to latissimus dorsi, that is the extensor of the shoulder joint. Okay. Levator scapulae elevates. What does this pointed structure do? The rhomboids. The rhomboids, as you see it connecting the vertebral column and the scapula down, it is going to pull the scapula towards the vertebral column. Retraction of the scapula. That's the right answer. Got it right? Okay, this is another question in the upper lip. The patient was unable to flex the interphalangeal joint of the ring and the little finger. Could not hold paper between all the four fingers. Right? So that itself a lot of clues there. What is the test performed? That's the card test. Why do you do card test? Okay. Card test is done to test the action. Like what do you do to hold the fingers together? What is that action called? Adduction of the digits. Right. So what are the muscles which cause adduction of the digits? Yes, the palmar interossei. Right. The palmar interossei, it causes adduction of digits. You must have remembered the mnemonic, right? Pad. Whereas the dorsal interossei, what do? They cause abduction, dab, isn't it? Okay. So these palmar interossei, not only the palmar interossei, also the dorsal interossei, all of them are going to be innervated by ulnar nerve. Okay. Yeah. So now you know the answer is ulnar nerve. But what did they ask? An image, right? A picture of humerus, the front, anterior and posterior aspect of it with ABCD. So what is A here? A here is the surgical neck of humerus. What is B? B here is so this is the head that lies medially, right? So B is going to be the lateral condyle of the humerus. C will be the medial condyle or the medial epicondyle above it. Okay. And D is supposed to be the spiral groove. Okay. Now, what are these structures? Any important structures related here? Yes, we'll see. So, surgical neck of humerus winding around. This is the humerus winding around the posterior aspect of the surgical neck of humerus. What nerve do we have? Yes, axillary nerve, right? So what are the muscles supplied by axillary nerve? We know, right? Deltoid and teres minor. What is the action of deltoid? It's not going to act over the interphalangeal joints, right? It's going to cause abduction of your arm up to 90 degree. And teres minor, that's a lateral rotator of the humerus. Okay, done? Okay, deltoid is abduction of arm and teres minor, lateral rotator of arm. Okay. Lateral condyle, nothing important passing behind it. Medial condyle, yeah, medial epicondyle, what is the nerve running behind it? When you press your medial epicondyle, right, your elbow over some hard structure for a long time, you get to feel a tingling numbness sensation along the medial aspect of forearm and the little finger. Yes, it's because of the compression of the ulnar nerve, right? So any fracture involving the medial epicondyle can damage the ulnar nerve and hence the palmar interossei car test, all right. And for completion's sake, over the spiral groove, what is the nerve? The radial nerve in the spiral groove. And if that's injured, yes, the patient is going to present with, yeah, wrist drop, finger drop, thumb drop, all that we have discussed, right? Okay. So you got it right? Okay, the option was, yeah, C. Coming to the next interesting question, arrange the following from lateral to medial according to the structures present at the floor of the fourth ventricle. So if you have understood the concept behind this, it would have been literally very easy. Okay. So I'll just teach you that. So this is the midline. Okay. Now we have the efferent column and then the afferent column. Efferent and afferent. Okay, between the two, we have the sulcus limitans. So remember, this is the midline, the axis. Efferent is closer to the midline, afferent is away. Okay, now this is the sulcus limitans. You must have seen it in the floor of the fourth ventricle, right? Okay, now these terms, what are the terms that you're seeing here? Visceral, right? General, somatic, special. Okay. Now you should remember that the visceral columns, okay, the visceral columns are closer to the sulcus limitans. And the special column, the somatic columns will be away from the sulcus limitans. Okay. Visceral columns are closer to sulcus limitans and the somatic will be away. Okay, I'll write it here. Visceral is closer to sulcus limitans. Somatic is away from sulcus limitans. The second point that you have to note is that general will come first. Special will come next. Okay, which means here general, special. general, and then special. Okay, here also general, special, general, and special. So to write it here, general somatic efferent, special visceral efferent, general visceral efferent. These are the afferent columns, right? I'll put a different color. General visceral afferent, special visceral afferent, general somatic afferent, special somatic afferent. Did you get that? So this black line is the axis. Then I've divided into a efferent column and afferent column. What do you have between the demarcation between the efferent and afferent? The sulcus limitans. Okay. Now, did you get that concept? What concept? Yeah, the visceral columns are closer. The visceral columns are closer, right? And the somatic columns are farther away. Okay, and then you have general and special. General, special. General will be closer to the sulcus limitant, special will be away. General, special, general, special. Okay, yes, give a minute, think about it, recall it, write it and see. You'll understand, you'll be able to remember it well. Okay, so now coming here, this is what I told you. Your picture, all the textbooks will have a similar image, you can go through it. Okay, so here as you see here, I'll just add to it. General somatic efferent. What are those? The muscles that supply the eye and the tongue. What is that? 3, 4, 6, and 12. So these nerves, they emerge on either side of the midline. Yeah, from the midbrain, from the pons, from the medulla. You'd have seen they lie closer to the midline, right? Oculomotor, trochlear, abducens, and hypoglossal on either side of the midline. What is special visceral efferent? The one which come from the arches, which are going to supply the muscles of head and neck. Nerve of the first arch, 5, second arch, 7, third, 9, fourth and 6, 10 and 11, isn't it? So that's the special visceral efferent. Okay, the pharyngeal arch nerves and the muscles which are going to supply the muscles of head and neck. And the third one, yeah, those are the cranial nerves which carry parasympathetic component, which are going to supply the glands in the head and neck, the salivary glands, the lacrimal glands, and vagus, the parasympathetic vagus. Okay, so you have to remember this by all means. Okay, tip of your fingers. 3, 7, 9, 10. Right. And general visceral afferent, special visceral afferent. Okay, nucleus tractus solitarius. Yes, 7, 9, and 10. Okay, they both have a same nerves. And general somatic afferent. Yeah, general somatic afferent pain sensations. Okay, from your head and neck is mainly the fifth nerve. Of course, part of the 10th, the auricular branch of vagus, we can include that also. And 7th nerve, because of its communication with the 10th nerve, they come under general somatic afferent. And lastly, special somatic afferent, 2 and 8. Okay, now going back to the choices, please go through this topic again. It's very easy to remember. Okay, so the first one is the general somatic efferent, and what should be the last one? Special somatic afferent. So start with A and end with D. Then we have two options. Either it could be this or this. Which one? Immediately like before the D, which one? Special somatic afferent. Just before you have the general somatic afferent. Is that given? So B. So just before D, B. So this should be the right answer. Got it? Okay. So it's just a simple formula to remember. Efferent, afferent, sulcus limitans. Viscera closer to the sulcus limitans. General come first. Special comes next. Okay. Visceral closer to the sulcus limitans. Somatic away. General come first. Special come next. Okay. You can write it and see. Auscultation points superior to inferior on the left side. That was again a direct question, right? Yeah. So you know the position of the valves, right? Here, third costal cartilage, that's going to be the pulmonary valve. And this one below that here, this will be the fourth costal cartilage. This is the pulmonary valve. This is your mitral valve. And this one here, yes, closer to the left third intercostal space, that's going to be the aortic valve. And this one lower down, that will be the tricuspid valve. Now the auscultatory areas differ from the valvular position, isn't it? So on the left side, behind the sternum, the topmost one is going to be this one, second intercostal space, the pulmonary area, right? And lower down in the left fifth intercostal space here, this one is going to be the tricuspid area, and left fifth intercostal space lower down here, half an inch internal to the mid-clavicular line, that's going to be the mitral area here. And the same on the right side, second intercostal space here, closer to the sternum, this will be the aortic area. So the one which is not on the left side is the aortic area. The one which is superior most on the left side will be pulmonary, and then comes the tricuspid, and lower down will be the aortic. Okay, did you all get it right? Easy only, no? So A, C, and then B. So the right answer is, you got it right? Okay. And this was again another easy question. Okay. So match the correct pair of nerve supply with the corresponding action. Okay. So facial nerve here is all, they have asked about the tongue, right? So tongue, if you see, that's the sulcus terminalis. What do you have in front of the sulcus terminalis? The circumvallate papillae. Yeah. So what is the nerve supply to the tongue? Yeah, the posterior most part that close to the epiglottis, the vallicula, that area here, this area is going to be innervated by the 10th nerve, both general and taste sensation, isn't it? The posterior most part. And the posterior 1/3 behind the sulcus terminalis, along with the circumvallate papillae, it is the 9th nerve, both general and taste sensation. Now the anterior 2/3 of the tongue alone, it differs, right? The which one? The 7th nerve, chorda tympani branch, that carries the taste sensation, whereas the the lingual nerve, right? The lingual nerve, which is a branch of the mandibular division of the trigeminal nerve, that carries the general sensation from the tongue. Now we look into the match, okay? So facial nerve is D. One is D. Yeah? And glossopharyngeal nerve 3 is B. Right? Posterior 1/3. Coming to the other two nerves, facial nerve, right? Facial nerve is going to cause, yeah, we saw, right? Facial nerve is anterior 2/3, chorda tympani, branch of spinal axillary nerve which is going to supply the trapezius. That's going to cause shrugging of the shoulders. Yes, shrugging of the shoulders. Glossopharyngeal nerve, posterior 1/3 of the tongue. Mandibular nerve, the muscles of mastication, the four muscles of mastication, masseter, temporalis, medial and lateral pterygoid, which are going to help in chewing, that we can lock it for this, isn't it? Fourth C. The only doubt could have been like, yeah, but it's given still, right? Taste from the anterior 2/3 of the tongue. So it has to be facial nerve. Okay, general sensation is mandibular nerve, lingual branch. So the correct answer for this one would have been easy. Okay, this is also another easy question, right? So what I heard is that A, B, and C was marked. The position of appendix. So what is A that goes behind the cecum? The most commonest position, retrocecal, isn't it? Yeah. B by the side of the cecum, paracecal or paracolic, paracecal, paracolic. C will be below, right? The subcecal. So the commonest position is retrocecal. What are these then? These are the pre and post ileal, isn't it? Yeah, this one will be the promontoric type, and this one is the pelvic. But I heard that the options were A, B, C, and this was the one given. So it is almost straightforward and easy. A is going to be retrocecal, B paracolic or paracecal, and C is subcecal. Easy? Okay. And there were two questions on auditory pathway with both of them had components of the auditory pathway and asked to arrange in the sequence, right? The correct sequence. But there are two questions I heard, right? Okay. So all of you must have known about this mnemonic for auditory pathway, a widespread mnemonic, right? For the auditory pathway. So the eighth nerve, yeah, the eighth nerve has two components. Which one is concerned with the auditory pathway? The cochlear nerve. Where does this cochlear nerve come from? So within the inner ear, we have the spiral ganglion, right? Spiral ganglion. The spiral ganglion will have a central process and the peripheral process. The peripheral process is going to innervate the hair cells, isn't it? And the central process of which is going to form the cochlear nerve. This cochlear nerve will come and end in the cochlear nucleus. There are two sets of cochlear nucleus, ventral and dorsal. Okay, it is present in the medulla and also in the lower pons. Okay, and then the fibers from here, okay, the ventral and the dorsal cochlea stria, they will reach the olivary. Okay, they'll also come and lay in the olivary nucleus, the superior olivary nucleus, which is in the pons, right? And then the efferents from the olivary nucleus and the cochlear nucleus, they together form the lateral lemniscus. Lateral lemniscus, where do you get to see? In the pons. Now the fibers, the lateral lemniscus will go and end in the inferior colliculus. Inferior colliculus of midbrain. Okay, midbrain. Now, this inferior colliculus will reach the medial geniculate body through the inferior brachium. Medial geniculate body, where do you get to see it? It's in the thalamus, the part of the pulvinar, behind the pulvinar, the medial and the lateral geniculate body. Okay, now from the medial geniculate body, the auditory radiation, yeah, it's going to pass through, yes, the internal capsule, the sublentiform part of internal capsule. And where do they reach? The auditory cortex, the primary and the secondary auditory cortex in the temporal lobe. Okay, the primary auditory cortex, what is its name? The Heschel's gyrus. Okay, Heschel's gyrus. It ends there. Okay, so this is the auditory pathway. A few years back also they've asked the same thing to arrange in the sequence. You have to be very much thorough. So the first order neuron in this pathway is the spiral ganglion, the bipolar neurons. And the second order neuron will be the cochlear nucleus, the neurons there. Okay, and this also the olivary nucleus. And here third order, medial geniculate body. Okay, it is a 4-order neuron pathway. Okay, so guys, I hope you all got it right. Coming to the analysis of the anatomy questions asked in this INICET May 2023, from the students' feedback, I didn't get to hear any questions from histology or embryology. Like, I'm not very sure they told a picture of development of eyeball with some canal marked there. I'm not very sure. Okay, but I didn't get to hear anything. And upper limb, yeah, upper limb, we know like the nerve injuries are high yield topic. They keep asking again and again. And the muscles of the back, image-based question was also asked. Lower limb, as usual, superior gluteal nerve, right? A very, very important topic. Thorax, they've asked about the auscultation points, order arranging it from superior to inferior. Abdomen, 2 questions this year, right? From duodenum and appendix, yes. Image-based question from appendix, relations from duodenum. Head and neck again, cranial nerves, cranial nerves, cranial nerves. Auditory pathway, like no image-based questions in head and neck, right? Okay, auditory pathway, the question has been repeated twice. And neuroanatomy, again, 2 questions. Okay, one was the cross section of medulla with the answer given, they were telling, and the functional column. Okay, so totally around, if you see 5, 7, 8, 9, 10, 11. 11 questions were asked, and most of them were image-based questions, or they were direct questions, isn't it? Not tough. So you could have easily answered it all right. And as you see here, everything has been covered in ADrPLEXUS workbook. If you have worked it out, yes, you would have got it 100% right. The concept has been, for all the 11 questions, the concept has been taught to you in all the regions, and it has been covered in different aspects of ADR classes. Hope all of you got it right, all the anatomy questions. Hope the session was useful. Thank you, guys.